Hello, VETAHEADers! How you doing, my friends? Hello, Dr. Proença here. How you guys doing? We're about to start another Darlings. Darlings, if you're not familiar, let me get myself straight here. Darlings, if you're not familiar, is when I share my favorite product of the month or service of the month, something that's really helping me on my journey with Zoomed or exotic animal medicine, something that is really helping me in my practice and is really making my job, my day-to-day job, be way easier. In this case, we are talking about Zoomed or exotic animal medicine. So what am I using? What tool or what service or what product am I using that is making my life easier? So I'll share with you every month. Hello, everybody. Hi, Kami. I share with you every month something that's making my life way easier. So if you have a friend, a technician, a vet student, a technician student, someone that can benefit from learning something really cool that's going to help their practice, share the link of this live with them, tell them that we are here. And also, I want to hear from you. I want to hear from you. What is a tool or a service or equipment that you feel like you cannot live without, makes your life super easy as a clinician or a technician working with Zoomed or exotic patients? Do you guys have something for me already? Like, for example, in the past, I shared the exotic formulary. I can't live without it. It has the doses for everything, right? And I bet a lot of you have them. But today I want to share with you something that I'm very proud of. It took a lot of work, sweat, and tears, but I legit use it. I legit use it every day when I'm practicing, and we just made huge improvements to it. And I want to make sure that you know of it, that you can use it, because it makes life so easy, okay? What I'm talking about, it's our emergency calculators. Let me break it down for you. If you are a VETAHEAD member, you have had access to the emergency calculators for a long time already. So basically, it's where you go. On the website, you put, say you're seeing a parrot, you choose the bird calculator, you put the weight in kilos, and it calculates all the emergency drugs for you, right? So now, what we've done, we really put it on steroids. We really improve the calculators so they have other things that not just, I can say they are urgency things that you might need, drugs or fluid, all of that. So we added a lot, and we made it compliant to the 2024 Recover Guidelines, which are the guidelines for emergency, right? For the CPR. So we made it compliant with those guidelines. Because, for example, with the Recover Guidelines, now we supposed to be using low dose epinephrine, low dose atropine, and then we adjusted all of that in the emergency calculator. So let me show you, okay? And we also added 2 new calculators. We added the pet chicken calculator and the pig calculator. So let me show you. Once you I'm gonna use my computer here to show you, because this is legit what I do. Once you log into your VETAHEAD account and you go to your calculators, it's on your left. I can make that journey with you right now and log into my account. I use VETAHEAD as a user as well, to make sure that you guys are being able to use it. So this is the dashboard. I'm gonna cover my picture in my email there, but your dashboard is gonna look like this, right? And then here on the left, you have things that you use like very often. And of course, the calculators are gonna be right here. See, calculator. So when you click on it, it's gonna take you to this page where you can choose between all the calculators. Look how cool. See, so you see the ferret calculator, guinea pig calculator, cetacine, which are the parrots. You can use the reptile, rat or rodents, rabbit, sugar glider, chicken, hedgehog, and pig, okay? So what is different about this? Let me show you. I'm gonna use for example, cetacine calculator. First of all, they look cute now. Look at this. They look cute, okay? Before, the way it would show the results was not very, I didn't like it. was not very easy to see, and it was not as visual, I would say. And it didn't look pretty. It was just like a blank page with the numbers and stuff, okay? So now it looks cute. So you have there, like this one is the cytosine, and you have these two boxes here. One, you put the name of your patient and then the weight in kilos. So I'm gonna do right now an example. I'm gonna use my Coco, because this is the cytosine. As you know, I have an African gray parrot, so I put her name there, and I'm gonna put her weight, which I don't remember right now, but let's say 480 grams, okay? So you need to put the weight in kilos. That's very important. So I put here, her weight in kilos is 0.48. I'm assuming she's 480 grams. I don't remember. That's horrible, huh? That I don't remember her weight. And then, as if you can see here, it has calculated everything for me, okay? It has calculated all the volumes for me. When do I use this? So if I have a critical patient that is hospitalized, I print this. If I have a sedation that I'm gonna do on a patient, say to take x-rays or collect blood or whatever it is, I have print one. If I am gonna anesthetize a patient, I definitely print one. And of course, if I'm doing CPR, if a patient comes for CPR, I'll have someone printing one while we are starting the CPR, of course. Because as we know, the CPR, we don't give any drugs until the second cycle. So this one, so during the first cycle, which is a 2-minute cycle, for basic life approach first, you're not gonna need these drugs right away, right? Okay, so what have we changed? First of all, I put everything in alphabetical order, and I added a lot of things. Like, for example, some of the drugs you have here, I'm gonna go through a list. So atropine, okay, obviously that should be there. And for rabbits, for example, we're gonna have the glycopyrrolate instead. You have calcium gluconate, like for the treatments that are associated with like hypocalcemia. For example, if the patient comes seizuring or tetany caused by low calcium. So then you have there the calcium gluconate, and it will give you the dose and how you're supposed to give it, like a bolus, for example. Then it has also the calcium gluconate for the treatment of hyperkalemic cardiotoxicity. So for other circumstances, for example, then it has the dextrose bolus. Let's say the patient came with low blood sugar, so it has the dextrose dose for you to give right away, and it tells you, for example, that you need to dilute that. So it says dextrose, and it has the let me make it big for us, shall we? So I have there dextrose right here, and it has the dose, the concentration of the drug, the volume you're gonna give, and then it has comments here. See, on these comments, for example, I am telling you that we should dilute 1 to 2 or 1 to 4 and give it slowly over 5 minutes, okay? So that also has the dose for diazepam, okay? If you were treating a seizure, for example. Definitely, at this name, I'm gonna butcher it. Diphenhydramine, which is an antihistaminic, right? So if you have, for example, a patient that you gave vaccinations and is having, an allergic reaction to it, or if you have a patient that was stung by a bee or something like that, so you have the dose here. This is a new one that we didn't have before. Then it has some vasopressors. For example, we have dobutamine, and we also teach you how to dilute it. So, okay. You guys see there? So let me flip the camera and show you. For example here, dopamine, okay, dobutamine, and it has how you dilute it. Add 4 ml of the dobutamine at this concentration, 12.5 mg per ml, to 500 ml of saline to make 100 micrograms per ml, okay, or 0.1 milligrams per ml. And then the CRI dose is going to be, or the constant rate infusion is going to be 15 micrograms per kilo per minute. So it shows you the dose here, the concentration, and the volume you're going to give in mLs per hour. So you don't need to do the math of the CRI. It gives it to you as long as you dilute this way. Isn't that so cool? Okay. So as I said, all of them, you have the drug name here, the concentration of the drug, the dose, the route you're going to give, the volume you're going to give, and then it has the units and comments here, right? Like as I told you, you will have comments. Oh, let's focus. Okay, you have comments right here, how to dilute, etc. So, for example, I told you dobutamine. We also have dopamine, okay? We also have doxapram, epinephrine, and as I said, this epinephrine is already following the new guidelines where we give the lower dose. It has flumazenil in case you need to reverse an benzodiazepinic. Let's say this patient was anesthetized or sedated and you use midazolam, then you can reverse, okay? Furosemide, if you're dealing with, for example, congestive heart failure, you have the furosemide dose for you right there. Again, you just need to make sure that the concentration that you're using of the drug matches. Glycopyrrolate here, hetastarch. So then we also have here the colloids, right? So we have hetastarch is one of the colloids. This gives you the bolus you're going to give and also the max. Like we shouldn't give more than 20 mLs per kilo per day, okay? And it will give you the volume for your bolus. Then we also have hypertonic saline. Yay! And the concentration of this hypertonic saline, how much you're going to use in case you don't want to use. You want to use a colloid that's not a synthetic colloid, then you can use hypertonic saline. Then we also have lidocaine here if you were treating ventricular tachycardia. How cool is that? And it says monitor ECG. And then it says the concentration here and then the bolus you're going to give. How easy. How easy. Then lidocaine CRI again, if the bolus that you were giving, if the bolus was affected, this first bolus affected to treat ventricular tachycardia, then you continue with a CRI of 25 to 80 micrograms per kilo per minute, and it calculates for you. So we'll tell you how much to give, okay? Again, and then here, maintenance fluids. This is new one as well. So the maintenance fluids for the majority of cytosine is going to be 100 mLs per kilo per day, and we'll tell you per hour how much you are going to have to give, right? Then mannitol, this is also a new one. Say you have cerebral edema, the bird flew into a window, hit the head, and you need to treat it, okay? Here's the doses for you and how much you're going to give. And it says give slow over 10 to 20 minutes and use a filter. Very cool, right? Then midazolam, again, if you are having a distressed patient, for example, respiratory distress, you know, or if you have a seizure, then you can give midazolam. Naloxone to reverse any opioids, again, in case you had the patient being sedated or anesthetized, or you just treated with opioids and you think it might be causing the problem. Phenylephrine, again, as a vasopressor, teaches you how to dilute at the doses, and it's going to tell you how much to give a CRI of a ml per hour. Shock fluid boluses, okay? You need a patient with hypovolemia and you need to do shock fluid boluses. And then he also has here the fluid and the dose. How cool. Tetrastarch is another synthetic colloid. Vasopressin, another pressor, and VETStarch, which is another synthetic colloid. See what I'm saying, guys? See how cool this is? And then we'll have it for all the animals. As I told you, okay, you're gonna have them for all the patients. So look at here. You have for the ferret, you have for the guinea pig, and chinchilla, you have the cytosine, the reptile, rat, mouse, hamster, and gerbil, rabbit, hedgehog, mini pig, brand new. We didn't have this before. Sugar glider, and also chicken, which is brand new. We did not have it either. So literally I have all of them open here. So see the mini pig here, and then you can put the weight in kilos. See how everything says 0 here? So I'm gonna put an anecdotal weight here, let's say 15 or 14 kilos, okay? It automatically calculates everything for me. Look at this, okay? So the same thing here, cytosine that we were looking, reptile. Again, guys, it is a super useful tool for you to have, for you to be using with your patients. It really saves so much time. And it's also peace of mind because you don't need to be calculating like CRI dosages or anything like that. You can just literally use this and go with life and worry about attending to your patient rather than being calculating this dose and running the risk of not getting the dose right because you're calculating. Sometimes we don't have time to double check what we're doing. So again, this will really make life very, very easy for us. Now, I also like to have this printed ahead of time. So for example, I will have on my crash cart, right? I already have my crash cart and I will have them printed for the most common weights. So for example, for a rabbit, I will have like a 1 kilo. I will get the emergency calculator for rabbits. I will put, there is a 1 kilo rabbit and I will leave that. Sometimes I will even laminate it and have it with my crash cart. So if a rabbit comes and is around 1 kilo, it's easy for me to do quick math if I need to, if I don't have time to go there and quickly use this calculator. Although I have to tell you, there's always someone that can access the calculator and print it very quickly, but I always have those anyway. So like for a bird, for example, cytosine, I will have like a 300 gram one printed. And again, I will get the average weight of a patient from that species, and I'll have those printed in the crash cart just to be double safe, right? You can also print it directly from your cell phone, which is very, very useful too. You just need to have the printer connected to your phone. And then what we're gonna do is I will pretend here that we are gonna print this one. Okay, so you click here after you put the weight, you click in print, and then it will have it. Oh, of course, because I'm showing you. It's not gonna show you the numbers for some reason right now. It's not it's my computer, but I promise you will show all the numbers here for you. Let me see if I were actually to print, if it will show me. Why are you doing this? It's just because I am showing you print results. Let's see. I promise you would print with the numbers here, but it prints you. It will have the name of your patient here, the weight, and it will say there's a cytosine emergency drug calculator. This is very important, guys, because a lot you can, and that's why we also have it. Let me cancel here. That's why also we have with, and which is also news. It's also new. We have like the little animals, so you really in a pinch, in a hurry, you can identify the calculator and get the correct calculator. Okay, so as you can see, guys, it's a super easy tool. I use it literally every day I'm in practice. Every day I'm in practice, I use it. Even like I told you, for patients that are hospitalized, they always have in their cage, from the cage, the emergency calculator, because I can use for so many things, right? If I'm gonna have a rabbit be vaccinated for rabbit hemorrhagic disease virus, I'll have it because it already has for me there the dose of the antihistaminic. So all of those things I will have there to make my life very easy. Have you guys used it? Let me know. But this is what I had to share with you this month because it was a huge undertaking to have this done, and I'm so happy with the results. I am so proud of it, and I hope this is also very useful for you in practice. Oh, last but not least, to have access to them, you need to be a VETAHEAD member, so essential member. So you need to have our membership. You can sign up to pay it yearly, every year you pay, or which is $420 per month as of today. We are in August 2024, or you can pay monthly, which is $35 per month, and you have access while you paying monthly. So this is just one of the things that we have on the membership. You also have all our online courses that you can watch, rewatch, our ebooks, our anatomy books, or our anatomy guides. You have our quick guides, sedation tables with all suggested protocols, all the vital signs for the most common pets for you to have, all of the good things that we have at VETAHEAD. So the membership gives you access to all of this, plus the emergency calculators, okay? Let me know if you guys are using it. Let me know what product, service you have been using or tools you have been using that makes your life really easy when practicing Zoo Med or exotic animal medicine. Thank you so much for being here, and I'll talk to you soon. Bye-bye.